Now, the most important thing I want to show with this case is that the tissues after you are done are gorgeous. Notice how I'm not moving as fast as I used to move with an 810. I can slow down. Now, you'll see in a second, as it's coagulated, I will take a little Q-tip and I will just wipe off the excess tissues here. This right here, it is a crown prep, the patient was, but do I have to? I don't have time right now, but I actually we have videos of actually doing uncovery of implants, no anesthetic at all. The patient told me that it was about 1 to 10 pain. Said she felt a 3 once or twice, and I was able to go in and uncover the whole area. Now, I did keep my powers down a little bit, and it probably took me about it was 2 implants, probably took me about 7 to 8 minutes to uncover, and to get to exactly where I wanted it. But notice here with that tip, how I can bend it around into areas which you couldn't get with some of the other ones when they had the plastic tips. These tips are incredibly good. It does. This way is you're going to find that with the way we treat it, and we'll talk a lot more about this in the restorative aspect of it tomorrow, how to treat the tips and how to really make it cut on the side. 2 things you're going to learn is how to trough and how to bevel. And once you've learned that, you've learned how to use the diode laser. So yes, and in fact, you're going to see me on the side here. I'm going to be using the side of this laser. See, when I'm using the tip, it's going to cut faster. When I'm using the side, it cuts slower. And so I want to go through, and you'll see in a second, bevel the side of it, and more or less sculpture my tissues down. See, now I'm using the side of the tip right now. And I'm just going through and just sculpturing everything down.
Is that tip initiated?
Yes, it is initiated. Now we get totally finished here. I like to show this because this kind of shows everything. It shows you how to trough. It shows you how to go through and bevel. And when we get all finished with this case here, you're going to see what the... Yes. The only difference between the two is that you need to move a little bit faster with the 810. You can bevel. As a matter of fact, in the restorative section, I'm going to be teaching only on the 810. Everything I'm going to show you is going to be 810. And Chris is going to be showing you the 940. But notice now, as I go through with our little bonding, look how pink those tissues are. Absolutely no thermal interaction there. I'm doing... not really, because your high-speed suction supports all that. Yes, because the MD is more of a cold cut. This is more of a heat cut. And if you don't have your suction there is some smell. I totally agree with you. Got to be careful of that. So keep there, and you can suck the plume out of there. Chris was going to talk a lot more about it. But this just goes through and it shows how I can go in and just do a little bit of beveling. Actually, what this case is, actually there's 2 bites here, isn't it? This patient didn't want to lose his tooth, but he had a bad mesial root, so I took the mesial root out, set some bone in there, and then where he went in, did a little DO inlay type prep, and I'll put a crown on here and hook them both together. So I'm actually just making a flat right here with the little easy lays to get a little better ability to floss this area. And you can see again how these tissues are just beautifully pink. Okay, that's pretty much what I wanted to share with you, because we've kind of started from 1990 and a real fast trip up memory lane here to the year 2000. And so as we go through the next two days, I really want to answer all your questions. And so, like you've been going so far, ask the questions. Ask of Bob, ask of Chris here. We want to give you. And it's the last little thing, I think we're just going to take a look at it. Now look at our tissues. Beautifully pink. This is what you want to see when you're done. And this is going to heal up in 6, 7, 8 days. You won't even know it's been done at that time. So the Easy Laser is an incredible laser. I'm not saying that the other diodes aren't, because I've truthfully, I use my 810s every single day. I have one in every operatory. But if you're interested in getting into lasers, it is a really incredible new laser because it's small. I mean, just kind of grab hold of this and walk around with it. It's great.